And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. I think this is something that we talk about a lot. Antibiotics versus not taking antibiotics, and especially when it comes to kids and young kids, because you don't really know, will the antibiotics help them or do we not give them the antibiotics?
I think overall the pediatricians do a much better job than the internists and family practice doctors. There is a lot of pressure from the general population to prescribe antibiotics, especially for the adult population. We do run a business, and a lot of times, we are there to serve the customer, so to speak, and if they want the antibiotics, a lot of times we will do that, even though we might be able to get away with not prescribing antibiotics. So it's nice to know that in the pediatric population they have guidelines to help the physicians, and if the patients don't quite understand, they can look at those guidelines as well. The adult population, they're always updating guidelines as well. It seems to be a little bit tougher, however, in the adult population, but they always say watch and wait also in the adults, but you got to work, you got to take care of your kids, and you just want those antibiotics, and we understand that. We're trying to get better at counseling patients about the watch and wait aspect of upper respiratory infections. It's extremely common, so it is a problem. We just have to keep working on it.
Okay, on to some of our viewers' medical questions. This viewer writes, I'm 78 years old, a female. I get bladder infections 2 or 3 times a year. Then I'm put on antibiotics. By the way, antibiotics don't make me feel good. What can I do to prevent these? Do I need hormones? What causes this? Your advice is greatly appreciated.
Well, at 78, that's typical. The bladder changes, hormonal changes create colonization of bacteria in the bladder and can set up shop for repeated bladder infections. I certainly would recommend an evaluation of their bladder. Look inside the bladder, because bladder cancer can sometimes cause recurring bladder infections, but it's extremely common in 78-year-old female patients. Certainly if you have any chronic medical problems, try to manage those, including diabetes. Certainly you can get a gynecological evaluation to make sure there's nothing anatomical, but this is an extremely common issue. What can you do? Not really anything aggressive other than just be healthy. Some people drink cranberry juice, a lot of calories in that, so I don't really recommend that. There are tablets, cranberry tablets that sometimes can be tried. So not a whole lot to do, but just be healthy. It is an aggravating, frustrating issue for a lot of people.
Okay, on to some other questions. Can you still get pregnant while you're on your period?
Typically not necessarily, but weirder things have been known to happen. So certainly if we're concerned as physicians, we basically just check it out.
Okay. I have a friend that when she eats vinegar, it causes her face to sweat. What causes this?
Not quite sure. Anything we put in our mouth, water, beef, any medications can cause any type of reaction. So certainly if it's uncomfortable, I would discontinue that, but not quite sure what the chemical reaction is.
I have pain that runs up my forearms. It feels like it's between the 2 bones. Any clues what it could be?
Probably I would be concerned about tendinitis in the elbow or tendinitis in the neck, maybe a pinched nerve, extremely common, secondary to degeneration of the cervical spine, typically causes a burning sensation. So those the 2 things I worry about. A lot of times can treat those with over-the-counter anti-inflammatory medicines such as Motrin and Advil.
Okay. What can you use to get wax out of the ears when you don't have money or insurance to go to the doctor and you can't use Q-tips either?
Well, first of all, you don't have to remove wax in your ear. It is a normal part of the health of the outer ear, so they don't necessarily have to be free of wax. And a lot of times using Q-tips can traumatize the outer ear, cause it to bleed, pack the wax in more, cause more problems with hearing loss and infection. So we don't actually recommend doing that. Sometimes we have some instruments in the office. If it's really packed in there, patients come in that can't hear, there's buzzing in their ear, we can use that instrumentation to remove the wax, but we don't recommend it over the counter. There are some solutions you can purchase over the counter to loosen the wax and slowly get the wax out, but nothing mechanical like a Q-tip.
Okay, and we've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. A 67-year-old woman has neuropathy in the feet. It's severe with swelling during the middle of the night. The top part of her foot caved in while the swelling was still pretty good in the rest of her foot. What would cause that?
Well, the swelling itself can cause what we call pitting edema. It pits.
Ew.
If there's any pressure on it, it's just related to the swelling. I think I'd be more concerned about what's causing the swelling. Certainly patients can have chronic medical problems that can cause neuropathy and swelling, such as heart failure, kidney failure. So those are kind of associated. certainly get to her doctor if the swelling is worse or it's never been diagnosed before.
Okay, a 42-year-old diabetic has pain in their right shoulder and down the arm. She does have arthritis. Could that be causing this or something else?
Absolutely. We talk a lot about that on this show because it's an extremely common problem, cervical arthritis in the neck. It pinches the nerves as it progresses, and you can get all sorts of pain syndromes down the shoulder, the hand, the arm, and it kind of slowly progresses and can become debilitating. Normally that's when surgery is necessary. Typically can be treated conservatively with anti-inflammatory medicines. Traction can be tried, physical therapy.
Okay, a 46-year-old female broke her ankle a week ago. How long will it take to heal?
It just depends. I mean, if it's a big fracture, it might take a long time, but if it's a small one, maybe not that long. And it also depends on other comorbid illnesses. If they have a lot of medical problems, if they're overweight, that's going to extend the healing process. If they smoke, that can extend the healing process. Certainly, if they're on their feet a lot with their job or just their underlying activity, it might extend the healing process. A lot of different factors. Certainly, we try rest. The smaller the fracture, typically the faster it heals.
Should they elevate it?
You don't have
Use
to
that
do any
excuse at work.
Yeah.
I've got to sit and elevate it.
If they don't want
to
go to work, absolutely. Elevation by itself doesn't necessarily help the fracture.
All right. 60-year-old person left 3 numb fingers. Right foot is doing the same. What could cause this?
We talk about neuropathy all the time. Anytime you get numbness, tingling, that normally indicates nerve injury. It's up to the physician to figure out why it's being injured, whether it be a pinched nerve in the neck or back or the elbow. Carpal tunnel can cause that. Diabetes can cause injury to the nerve. Poor circulation, such as PAD. So a lot of different things, but that's what I'd be concerned about. Certainly they need a good workup to figure that out.
Okay. This person broke their foot 6 months ago. It's still painful. Why?
Again, a lot of times, depending on the original injury, you can have a chronic pain issue, especially if it did not heal very well. Certainly, you can go back and get some more x-rays to make sure it's healing properly. Especially if you had surgery, you want to make sure that it healed properly, nothing is wrong. A lot of times, the surgeon will see you back. But you can have a chronic pain issue with any type of injury just because of the initial injury and trauma to the body.
Okay. Does an MRI measure the amount of mass that Alzheimer has taken over, and does the discoloration also appear as a stroke on the scan?
It can, but it typically doesn't clue in that they have Alzheimer's. They're working on those types of x-ray tests. We certainly can see stroke, however. Normally patients who have Alzheimer's, we're looking for other things, brain tumor, bleeding, to explain why maybe they have memory issues, but it doesn't necessarily show up as Alzheimer's on the x-ray, but strokes do show up on x-rays very well.
Is the Atkins diet more unhealthy than is being obese, or is being overweight worse?
Big controversy. I think being overweight is worse. We've gone back and forth with the Atkins diet. I think it's very effective. It's just that you can't live on that diet forever. It does help you lose weight, but eventually you have to reintroduce yourself to the normal diet. We try to get them on fruits and vegetables, cut down on the starches. So I would get the weight off. Being overweight certainly very unhealthy, brings on a lot of issues.
All right, Dr. Levine, as always, we appreciate you stopping
Yes,
by. And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, email us at laf@kfdm.com, or you can post those questions every Monday on our KFDM News Facebook page.